I'd like to begin this segment with a quote from Emily Post. Ideal conversation should be a matter of equal give and take, but too often it is all take. Inquiry and advocacy is a tool that both team members and leaders can use. It helps you advocate for your own or your patient's needs while simultaneously uncovering and including other team members' perspectives. Advocacy can be defined by simply stating one's views, making your thinking visible, and testing your assumptions. While inquiry is asking about another's views, asking others to make their thinking visible, and comparing your assumptions to others. Using inquiry and advocacy may be especially useful when teams are newly forming, when team members may be unclear of the roles and responsibilities of others, or when multiple perspectives are voiced surrounding problem solving or patient care. Inquiry and advocacy ultimately helps to bridge multiple perspectives and promotes transparency, trust, and respect, as well as understanding amongst colleagues. When these tools are used successfully, an atmosphere is created where no one person necessarily knows the answer. Teams think together and arrive at new insights not achieved with unilateral decision-making. To do this, one must be mindful of balancing advocacy for their position with inquiry regarding other people's perspectives. Let's look more closely at different forms of inquiry and advocacy. This chart is divided into 4 squares, whereby the x-axis represents high or low inquiry and the y-axis represents high or low advocacy. In the lower left-hand box here, a person who has low advocacy and low inquiry skills often withdraws and does not share a lot of information. They primarily just observe. Conversely, over here, one who inquires too much, asking for information without sharing their own views or assumptions, tends to act like an interviewer. A person up here with high advocacy skills and low inquiry tends to give a lot of information without exploring others' points of view. And finally, up here, a person who properly balances both inquiry and advocacy fosters two-way communication for optimizing learning for both parties. So the first step in using this tool is for the team to engage in dialogue. Instead of interrogating, dictating, mandating, and holding on to your opinions, explore and inquire, listen, be transparent in reasoning and thinking, learn through observation, and be open to multiple perspectives. Now let's explore some conversational recipe starters. Here are some specific ways to make our thinking more visible with advocacy. First, be explicit in your reasoning or assumptions. One way to do this would be to say, "Here's what I think and why." "This is how I came to my conclusion." Or, "I made the assumption that." And even when advocating, listen, be open, and encourage others to provide alternate views. One way to do this would be to say, "What do you think about my reasoning? Do you see it differently?" Inquiry is a way to gather information from others in order to better understand their views. Ask others to make their thinking visible. More specifically, to do this, use unaggressive language, ask questions with genuine curiosity, and politely draw out reasoning. One way to do this would be to say, "Can you help me understand your thinking?" Or, "What leads you to conclude that?" Lastly, check your understanding of what others are saying and listen for new understandings that may emerge. You could do this by saying, "Is this similar to?" Or, "Am I correct that you are saying?" So let's take a short case scenario to illustrate how to apply inquiry and advocacy. A physical therapist wants to advance her patient who had a recent lower extremity amputation through increasingly difficult therapeutic exercises. However, the patient cannot participate in therapy due to uncontrolled pain, and the patient believes that other healthcare providers are reluctant to increase her pain medication dose. The physical therapist decides to approach the pharmacist on her team for help with pain control. What are some ways the physical therapist can approach the pharmacist using inquiry and advocacy? One example is like this. Hi, I'm Amber, the physical therapist. This patient reports poorly controlled pain and believes her healthcare providers are reluctant to increase her pain medication. Also, her goal is to improve her balance, but she's not able to participate in therapy due to pain. After examining her, I think she needs better pain control. So using advocacy, the physical therapist makes her thinking clear to the pharmacist. She could go on to say, I'm interested in learning more about the pain management protocol for this patient. Would you help me to understand the patient's current pain medication regimen? So with this inquiry, the physical therapist asks the pharmacist to explain the current regimen and her thinking or the thinking of the team. So in summary, inquiry and advocacy are two strategies that help teams bridge perspectives and create collective ideas and successful problem solving. Engaging in this exercise with transparency, humility, curiosity, and respect ultimately inspires mutual understanding and goodwill. Its effectiveness depends on a balance between the two, and it entails specific steps that can be learned and practiced in any setting. So for this segment's forum discussion question, think about a disagreement with a colleague, family member, friend, or even a stranger. Replay the situation and rephrase your position using one tool for advocacy and one tool for inquiry. Are these tools challenging to use? Why or why not?